Welcome to the IDEX Continuing Education Series.
Well, hello and welcome to another one in the IDEX Continuing Education series. Today we're going to talk about the fecal check, so fecal antigen testing. We'd sort of discussed the mechanics of the test in one of the other webinars where we talked about fecal parasitology testing with PCR, but sort of more looking at it from a client focus today with that. So I guess some of the questions we want to answer are, why would we recommend fecal examinations? Because, it's not always a discussion we're going to have with clients about that. So talk about the reasons for that. Have a look at when to recommend what testing, because we do have some choices with that. And then some tips for trying to optimize compliance. So the sort of how we talk to clients about it, some of the evidence that we can provide clients when making recommendations, and how to use those available tools. The question comes, why do we recommend fecal exams? I think we need to consider this in two groups. So we look at the patients that are unwell, and we look at it as from a preventive care point of view as well. I think, fecal parasitology is one of the things that we need to be doing as one of our first line tests in unwell patients presenting with diarrhea, because it's a simple thing we can look for, a simple thing to manage, yet we're not always doing that. I think it's got to be a really important focus on that. At times, patients that are losing weight, or if we look at it more from a young patient perspective, patients that aren't gaining weight at the rate we would expect them to, we need to, check for parasites and rule those in or out in this sort of setting. And whilst it might seem a little bit an odd one, putting anemia here, it's important when we consider some of the parasites, like hookworms or whipworms, that they can be a potential cause of anemia. I know that I've certainly seen patients over the years that have had significant anemias to the point of requiring blood transfusions that have ended up having whipworm burdens, and that was what was causing the anemia, especially in younger animals. So don't forget about fecal parasitology in that setting. When we're looking at it in well patients and we're sort of talking about preventive care, it allows us to detect occult infections, because we certainly can have patients that do have a parasite burden without clinical signs of that. And it really allows us to target the treatment to medications that are best practice for particular different types of parasites. It's important to remember that whilst they're not common, we can get, some of these parasites have zoonotic potential. If we look at some of those pictures there, nobody wants to wake up with a foot like that. That's, hookworms, penetrating the skin and burrowing through tissues. Roundworms, we can get visceral larval migrans with that. So I think, it's important that we consider this, and good parasite control is part of that. I guess it raises the question, why, is routine treatment enough with that? And, it's worth keeping in mind that I guess in the longer term, we've got good medications that we can use for antiparasiticides. But just like antimicrobials, the question is, in time, are we potentially going to be facing resistance with that? And it's also important to remember that, these are very good medications, but they're effective at getting rid of the parasites that are there. They're not going to have a residual action that is going to prevent that animal getting infected again. And with certain parasites like, whipworms or hookworms or things like that, or even Giardia, we've got to be considering the environment. And if we have patients that keep getting infected with them, some of our efforts need to be directed towards managing their environment to try and reduce the risk of reinfection. So the question is, what do we recommend at what time? You know, in sick patients, um, we need to be a little bit more extensive with what we do. And, we have the flexibility to, pick and choose the tests we do with that. As I said before, in an unwell patient with gastrointestinal signs, fecal parasitology is very important. We can do the fecal over and parasite exam in the lab. Remember, a simple fecal flotation in a clinic is certainly better than not doing parasitology at all, but it does have some limitations with sensitivity. In the lab, we use a flotation centrifugation technique, which does increase the sensitivity of the technique. We also now have the fecal antigen test, which is looking for, rather than larvae, is looking for antigen coming from the adult parasites. So this has a number of advantages. It increases the sensitivity of the test. We can detect things sooner because we don't have to wait for larvae to be shed. And we know with some of the parasites, especially things like whipworms, they can be intermittently shedding. So a negative flotation doesn't rule out that possibility. The other thing is, because we're not having to wait for larvae, the antigen test can detect the parasites significantly sooner, up to around 30 days or so sooner than the routine parasitology techniques. But in a patient with diarrhea, we still do want to combine that with the over and parasite exam. The fecal antigen is great for the whipworms, hookworms, roundworms. You can also do Giardia with it if you want. But, in some of these patients with diarrhea, we want to be looking to see, are we seeing Giardia cysts? Are we seeing coccidia and things like that? So the fecal over and parasite exam is good to add to that. Obviously, in a patient with ongoing chronic diarrhea, particular patients with acute diarrhea, so puppies or hemorrhagic diarrhea or unwell patients, adding the diarrhea real PCR panel with that can really broaden our approach to see if we can detect any appropriate infectious agents with that. When we're looking at preventive care screens, in patients without signs, the antigen test is a nice way to do that, because it's our most efficient way to do that. You can add the over and parasite exam on if you've got suspicions of other things with that patient, but probably the basis of our preventive care screening should be the antigen test for that. We can try and help you and help your clients with getting these fecal tests done. Through your lab supply orders, you can get these fecal collection kits. It's a scoop, a glove, and an instructional insert on what to do with that, so that if you're sending the patient home and you want the client to return a fecal sample for you to get the parasitology and the antigen test and maybe the PCR done, they've got all the bits and pieces to collect that at home and then bring it back to the lab. Then, you can send it off, through the courier network and get those results as soon as possible. With the preventive care side of things, where we're just wanting to check that, they don't have parasites. And keep in mind, there are groups like the Companion Animal Parasite Council, which is a group in the States that a lot of parasitology experts and medico-legal people and zoonotic disease experts and stuff, suggest that we should be doing 1 to 2 fecal tests a year in adults, even if they're on preventives, 2 to 4 in puppies and kittens. So the IDEXX Fecal Check Home Collection Kit is a really nice way to facilitate this preventive care testing. So you can buy these kits. They come in packs of 10, and you sell this to the client. Pop a request form in the, with them in the box, and so the owner can collect the fecal sample at home, and then they pop the scooping container in the box, and that gets mailed through Australia Post. It goes to the lab in Brisbane, they run the fecal antigen test, and then those results will come back to you through the way you normally get your lab results, like through VetConnect Plus, and then you can share those results with the clients. So it's it may take, because it's Australia Post, it takes a little bit longer to get to the lab. Not ideal if it's a more urgent patient, but with preventive care, that's not the case. So client collects the samples at home, puts in the post box, and you get the results through the normal laboratory system with that. So I think one thing we can do with clients is to try and provide them with some information on why this fecal testing is important. Sharing with clients that you suggest, even though they're on good medications, that testing their pets at least once a year if they're adults is good practice, to minimize any potential risks of that, best for their pet, to maximize their health, and being cognizant we don't want to scare people with the zoonotic disease side of things, but important that they're aware of that so that they know that they're minimizing any risks by doing this appropriate testing and treatment. Discussing fecal parasitology, getting into the routine with new puppies and kittens, to talk about the importance of that. So it's a lifelong thing with that client that they're going to expect to have this done, at least annually. There are things that we can do to help educate pet owners with resources on the value of that fecal parasitology testing. There are some examples here. The Companion Animal Parasite Council, which we discussed, this group in the States, a group of experts with parasitology, have handouts for clients that talk about the importance of this testing. Within our system at IDEXX, there are these brochures, the Pets, Parasites and People one. For your team within the clinic, we have the diagnostic updates on, the ins and outs of the fecal antigen testing, combining it with the fecal over and parasite testing with that, so that your in-clinic team realise the importance of doing this. And there's also information on, we have advantage programs that if you're combining tests, so for example, combining the fecal antigen profile with a PCR, you get a discounted price on the antigen profile. You can get a discounted fecal flotation if you're adding that onto certain tests. So we're trying to help you out cost-wise with that. So I think in summary, what we need to consider is, that choosing the right test for the case. For preventive care, antigen test is our first choice. But if we've got patients that are unwell and have diarrhea, the over and parasites, the antigen test, and the PCR in appropriate situations. Got the previous continuing education series episode on the antigen and PCR testing if you wanted some more detail on that. And obviously we've got some tools that you can share with clients to help educate them with that and helps them understand the value in your recommendations for that routine fecal parasitology. So that's all we've got today, keeping it nice and short and sharp. So I hope this is useful information for you. If you have any further questions, don't hesitate to reach out to your sales professional, or you can reach out to me via email or the call centre, and happy to have a chat to you to answer any questions. So thanks for your time today, and we'll catch up with you again soon.